Hi, my name is John Webb, and I'm an oral and maxillofacial surgeon. One of my biggest passions is to use my skills and knowledge to help my patients not only restore their ability to eat and smile, but also improve their confidence and quality of life. Um, I've seen numerous patients enter our office frustrated about their dentition, but leave beaming with excitement and satisfaction, really. These transformations are really what I get up for every day. They make me feel like I've had a positive impact on the community, and um, it doesn't have to be what people traditionally think of as a big case. Whether it's a full mouth rehab or a single tooth replacement, it doesn't matter to the patient, and therefore it shouldn't matter to me. And that situation is everything to the patient, and we approach it with the same respect. So guided tissue regeneration is treatment in oral surgery in which I tell my patients that I'm trying to create something out of essentially nothing. For dental implants to work properly, there needs to be a sound bed of bone for the implants to bond to. Unfortunately, many patients, due to localized disease, trauma, or long-standing dentulism, the bone has shrunk where it's too short or too narrow or both to house an implant. And in these challenging clinical situations, we must then perform guided tissue regeneration or bone grafting to reconstruct the bone that was lost. This process is one of the most challenging procedures in implant dentistry. The treatment entails the use of several different types of biomaterials in conjunction with meticulous surgery to create new bone. And because the process of creating a bone takes some time, it typically requires 6 to 9 months of healing before we can place an implant there. Deciding the appropriateness of this treatment is dependent on my conversations with patients during our consultation, which I spend time trying to understand the patient's goals and motivations. Because we're not here to do surgery for the sake of surgery, we're here to provide patients with a solution. We most commonly recommend guided tissue regeneration for patients in two situations. One, infection, and two, long-standing tooth loss. So let me go into detail. When patients have periodontitis, which is gum and bone disease, or develop a dental abscess, destruction of the bone ensues. The unfortunate part of this is that patients may not be symptomatic at all for years during this disease process, and therefore they may lose a significant amount of bone without knowing it. So when the disease is properly treated and arrested, the bone loss process stops, but what's been lost is permanent. In the other situation, when a patient loses the tooth, the surrounding bone is no longer stimulated. So as a result, over a long period of time, the bone atrophies, first typically in width, but then also in time in height. And like an infection, this bone loss is permanent. So once the bone loss has occurred, if the patient would like a dental implant at that site, the guided tissue regeneration is necessary to rebuild that lost bone. We understand that oral surgery is inherently an unpleasant experience for patients. No one is ever excited to come see the oral surgeon. Not something people look forward to and are excited about. With that said, we help comfort our patients with a warm welcome and by spending the time to understand each patient's concerns and apprehension. And by taking a minute during the consultation to talk to my patients on a personal level, I often find that I'm able to provide them confidence and comfort. Idealizing the bone contour prior to implant placement um, helps improve the long-term success of the implant. For implants to last a long time, they need to be both biologically and mechanically stable. To achieve that, the implants need to be placed in a very specific position and angulation. And when your bone is not the right shape, it forces us to place the implant in a position that's compromised. Now, the implant may integrate in that situation, and by definition, you've achieved early success because it's bonded to the bone, but you don't necessarily achieve long-term success, right? I find too often that patients have issues with hygiene challenges, broken implant components, peri-implantitis, etc., and it's at least in part due to a suboptimal implant position. So by spending the time to get the tissue right before implant placement, long-term issues long-term issues may be avoided. Ridge augmentation requires a fair amount of tissue manipulation to achieve our goal of creating new bone. This unfortunately does lead to a fair amount of post-operative swelling and discomfort. What you can expect is increased swelling over the course of the first 3 days. It'll plateau for a day or two and then steadily get better after that. I do tell my patients that typically you'll experience some swelling for 2 to 3 weeks after the surgery. We will review your medical history in depth and come up with a pain control regimen to help ensure that you are as comfortable as possible during the healing process and to minimize your discomfort. We'll also review critical hygiene and diet instructions with you to ensure that your recovery is successful. If you're missing a tooth and are interested in implants but have been told that you don't have enough bone for an implant, please reach out to our office so that we can schedule you a consultation to provide you with our expertise and knowledge.